Hi, welcome to this edition of Med Health Fit. I'm Eric Durak, and here we are in our second season. Tonight, I want to talk about self-care. And when most people go about their day, they get up, they get the kids to school, they feed the dog or the cat, they go about their daily routine. And most people don't really think about their own self-care in terms of their own health promotion unless they're walking at noontime or they're going to the gym after work. But if you could think about certain things during the day and certain tips that you could sort of self-think to yourself about how you could become healthier just by doing one or two extra things a day in addition to your workout, that's going to help raise your health IQ. So tonight's episode is called Managing Your Own Health, and they're everyday tips. They're reasonably simple, and there's something in here, I think, for everyone in the audience. So let's begin tonight's episode with the types of conditions that I want to talk about. So number one and number two are fairly, kind of linked together: obesity, overweight, and diabetes, because many people who are overweight either come down with pre-diabetes or eventually come down with full-blown diabetes over time. So the first two conditions that I want to really concentrate with the audience tonight are overweight and diabetes. The next one is arthritis, which we're going to really talk about osteoarthritis tonight, really the arthritis in the joints. The next condition is back and muscle pain. The next one is actually sleep problems. And the one after that is stress, how we deal with stress on a daily basis. And the last condition isn't really a medical condition per se. It's dehydration and drinking more water. And most people say, well, that's not really a medical condition. Well, dehydration actually is, and anyone who's ever run in long distance events or who's ever competed in sports and athletics in very hot weather know that dehydration is something that can come up on you very quickly. So we're going to talk about that, and we're going to give some cues and some information about how to stay well hydrated. So let's begin. Well, the goals of tonight's lecture, tonight's presentation, are to really give you some information about each type of condition and how it might apply to your own health. Maybe you're very interested in hydration, or maybe you're a few pounds overweight, or you've got a family history of diabetes, so you might be interested in those types of tips as well. The other one is to give you at least one type of assessment or therapy or some sort of thing that you can do personally to help prevent or manage one of the conditions that's on the list here tonight. And the last one is to reduce your chances of ever being diagnosed with any of the above mentioned conditions. And that actually includes dehydration. Because what most people may not know is that dehydration affects us every single day from childhood all the way through adult life. Poor health equals poor work. Most people are on the job most of their adult lives, and all of the things that we talk about can play into their work environment. People who have chronic health conditions, they miss more hours of work than people who are healthier. They're less productive on the job. They need to take more breaks. If they're doing physical labor, they need to actually stop more, which means, again, they're less productive. They have more accidents. The people who have overweight, who have back pain, who are dehydrated, who have problems with joints, they have more accidents at work, and therefore they cost their employers more money. And lastly, they're fatigued more. If you have a low level of fitness because of your diabetes or your arthritis, or even because you're dehydrated, you're fatigued, you do things slower, you have to take more breaks, you're less productive, and you just don't feel well. So how can we combat all of these things? Let's take a look at our next slide. And we're going to start with being overweight. About half of Americans are overweight now. Over a third of them are considered chronically obese. And being overweight is diagnosed as 20% above ideal weight, or body fat levels above about 25% in men and about 31% in women. People who are overweight have an increased risk for stroke. They usually have high levels of blood pressure, hypertension. Obviously, they are at higher risk of diabetes, but also Syndrome X, which is a cluster of different metabolic diseases. So what do you do to decrease your risk of being overweight? Well, everyone needs to change their diet. And some dietitians will say, well, eat less foods, eat certain types of foods, or eat at different times of the day. Being overweight means reducing calories, reducing the amount of certain types of fats that you have in your diet, limiting processed foods, which in my opinion might be one of the biggest scourges of society today, is that most people have a tendency to be eating most of their foods that are processed as opposed to fruits and vegetables and things that are not in the category of box foods, processed foods. More vegetables, more fruits, and if you're going to snack, I have here no snacking, but I think what I'm trying to say is no snacking with a lot of processed foods. My snack of choice these days is almonds and other types of nuts, because I know that I'm getting high quality fats and good proteins, but I'm also not getting very high calories. So it keeps me full for a longer period of time with very little calories. The second thing I have here for being overweight is to exercise every day. And it may be aerobics, it may be strength training, it may be a combination of those, or it may be a specialized type of exercise. At least 30 minutes a day. Record your sessions, record your blood pressure, record your body weight, so you know what progress you're making with your exercise program. And the last thing is to have regular meetings, especially with your doctor, your dietitian, and meet with your health coach or your personal trainer as well, and say, okay, I've been doing this a month, I've been doing this for 6 weeks. Am I on track? Do I need to change something? How is the diet going? Am I feeling better? Making sure that all of your paperwork is done and that you understand the course that you're doing in terms of your exercise and diet change. The other thing about being overweight is to shop well. You go into a grocery store, and historically, most people who are professionals in the area of dietetics say you should shop along the outsides. Everything on the inside is either the alcohol, the processed foods, the snack foods, the ice cream, and then more snack foods. So most of the middle foods are where the box and the processed foods are, and most of the outside is where you have your fruits and vegetables, your meats, your dairy products, etc. And that's where most people should probably be doing shopping. So shopping well. You buy the foods that you need to lose weight, and you discard some of the things that you probably don't need. And the other thing is make a plan. Make sure that with your dietitian, trainer, doctor, that you have a plan that you can say, this is where I want to be in 6 weeks, and this is where I want to be in 6 months or a year, and you stay with the plan. Most people say, well, I want to lose weight. And usually every January they join a health club, and by March or April they've quit the health club, because although they have great intentions, they might not have a good plan. So therefore they don't know what actions to take in order to make sure that they're accomplishing the goals that they set for themselves. And the last thing, which I think is very important, is medical follow-ups. You want to make sure that you see your doctor at the beginning, you get blood labs, you get their consult, and you get the recommendations, and then you do the regular follow-ups. And in one of our future episodes here on MedHealth Fit, we're going to be talking with Dr. Craig Brandman, who is the CEO of a company in Palo Alto called Step One Health, which is one of the country's largest independent blood labs for the general public. And this is one of the new areas of medicine, is that people are now sort of taking charge of their own health, and they're doing so by having their own blood work done. So there's lots of things changing in medicine, but one of the big things that I want people to understand is to have regular follow-ups with your doctor and with your dietitian and any other medical personnel that you have, your nurse, your health coach, anyone else, your counselor. And so the next condition that we're going to go into is diabetes, which is very closely linked with being overweight. Most people who come down with adult onset or type 2 diabetes usually have a very high level of body fat. Diabetes is a problem with carbohydrate metabolism, but it's mostly associated with being overweight. Diabetes is the leading cause of blindness in the United States, the leading cause of amputation, and the leading cause of nerve problems. A lot of people who have problems with nerves in the feet, etc. It's because of long-standing diabetes. The economic costs of diabetes in the United States are astronomical. Over $130 billion is spent every year on treatment of diabetes, and usually that treatment is medicine. It's the hormone insulin, it's oral hypoglycemics, it's glucose testing devices, and other types of things that are used to manage the diabetes, but not really in terms of lowering the impact of diabetes, like what we talk about with exercise and nutrition. Over 18 million Americans have diabetes. 95% of those are type 2, which means that they are non-insulin dependent, but many of them take insulin anyway to manage their diabetes care. So how can we look at managing and reducing the risk of long-term complications of diabetes through something very simple like self-care, diet and exercise? Well, let's look at the diet issue here first. Back in the mid-90s, Dr. Barry Sears came out with his 40-30-30 nutrition plan, which was more protein, limiting processed foods, and limiting total calories, but the proteins and fats make up a higher percentage of the total calorie intake. And the reason they do is because they have less of an impact on the amount of sugar in the system, and henceforth the amount of insulin that the body's pancreas produces on a daily basis. The second thing is exercise. Now, I have here trained 3 to 4 days a week to reduce blood sugar. Now, earlier in the episode here, I talked about training every day for general health. Now, some of those training methods may be just general walking, they may be a stretching program, they may be doing an exercise video right in your living room. But for diabetes care, when we say exercise 3 to 4 days a week, the intensity is usually a little bit higher because the main objective in exercise with a person with diabetes is to reduce blood sugars. Your fasting blood sugars, your after eating blood sugars, what we call postprandial, or your long-term blood sugar control, which is called A1C. We want all of those numbers to go down, and we want exercise to be the catalyst to make sure that those numbers reduce over time. And the last thing I have here on the slide is to monitor. Make sure that you monitor your diabetes status every day. That means before you exercise, just like before you eat, you do a blood sugar. And you'll make sure that when you're done with your exercise session, you take another blood sugar reading. So you want to make sure you're monitoring your body weight on a weekly basis, your body fat on a regular basis, and your blood sugars daily, especially pre and post exercise. Okay? So the next condition that I want to talk about is arthritis. Now there's two types of arthritis. The first is rheumatoid, which is an autoimmune disease, but I want to really concentrate on the second type of arthritis, which is called osteoarthritis. Most people are familiar with that, because osteoarthritis really affects the bone and the cartilage of the joints. So as people age, they have sports injuries or so, they might develop arthritis in the joints, and it becomes very, very difficult for them to move that joint. More seniors suffer from arthritis than almost any other disease. It causes a lot of pain. It reduces the amount of daily motion. And it's hard just to get in and up and out of the chair. It's hard to get into the shower. It's hard to do what we call those activities for daily living. You know, walking up and down stairs, getting on and off the toilet. The things that people have to do every day with arthritis becomes more and more difficult. So what are some of the remedies to limit the effects of osteoarthritis? Well, the first one might be a little interesting. I have here, it's optimizing your vitamin D levels. Now, on a couple of the other episodes here on Med Health Fit, I've talked about optimizing vitamin D, getting the right amount of vitamin D. Well, as it turns out, most Americans are woefully low on their vitamin D levels. Even here in Southern California, where we get a lot of sunshine, most people are working during the day. They're not out there, absorbing the sun's rays and getting vitamin D as they should. And vitamin D, as I've said before, is probably one of our most important vitamins in terms of the preventing and treatment naturally of many types of diseases. In fact, the National Institutes of Health and the Food and Drug Administration have actually said that vitamin D is the only supplement that can be stated right there on the label that it can actually help to manage, prevent, or cure a disease. No other supplement, no other food, no other alternative treatment actually has been given that status by the federal government. So the other thing is taking glucosamine and chondroitin supplements. And along with vitamin D, I think that these are very important in terms of keeping the joints more supple. There's been plenty of research on the benefits of both of these supplements. There are some opposing research articles, but I think that in general, most people agree that the glucosamine and chondroitin helps with range of motion, and it helps with pain-free movement over long periods of time. So exactly for your individual metabolic type. Well, what does that mean? It means if you have arthritis, you probably should not be engaging in drinking a lot of alcohol or other types of foods which may cause inflammation, which are mostly processed foods. And this inflammation also increases the severity of the arthritis condition. So when you're talking with your dietitian about your condition, you might want to mention what types of anti-inflammatory foods can I eat, which may help me to manage or improve the arthritis condition. Resolving issues of things like root canals and mercury fillings, which also have been linked to both rheumatoid arthritis and osteoarthritis. Most people don't really make the connection between their dental work and their joint health, but over the last 10 years there have been some research studies that actually show that having root canals and mercury actually may have some sort of rheumatic or rheumatoid problems over time. Getting sufficient amounts of high quality omega-3 fatty acids. If you're going to be having some sort of fat in your diet, we suggest here on MedHealthFit that you talk with your dietitian and your nutrition consultant and ask them about omega-3s, because they actually may help lubricate the joints as well as any other type of fat that you put into your diet. Well, what's the last one here? Regular weight-bearing exercise and stretching. It may seem like an oxymoron that if you have pain in your joints, especially your hips and your back, that you should do weight-bearing exercise. Well, here's why. As you increase the range of motion and you increase the pressure within the joint by doing the strength training, you're actually helping the fluids and you're helping the body actually sort of heal the arthritic conditions over time. So people who have been diagnosed with moderate osteoarthritis, who engage in strength training within 6 months to a year, can actually reduce those symptoms. And a lot of it is because the joints are just not used to being moved. So you're moving them in a wider range of motion with extra weight, and you're actually helping to help those joints, increase circulation, increase the synovial fluid, increase the lymphatic fluid, and by doing so, you're helping the joints heal at a much higher rate. Well, I don't know about you, but I've had back pain in my life. I had severe pain probably 5 or 6 years ago, incapacitated me for about a week. Luckily, I was in reasonably good physical shape. I was able to heal quickly. But most Americans, 80%, suffer from back pain at some time during their life. And many of those people who suffer from that acute back pain, it becomes chronic. It becomes a lifelong problem that they have to deal with. So what are we going to do here? We're going to look at the causes, which are mechanical, poor lifting techniques, even poor sitting techniques. I think I mentioned in one of our earlier episodes this season that sitting is becoming, the new heart disease. People who are sitting right now are having all kinds of ergonomic problems, and back pain is one of them. And one would think that, well, sitting is relaxing the back, but actually the back needs to be moved and stretched and lifting weights on a daily basis. So poor work habits, poor posture, inactivity, muscle imbalances, and prior sports injuries and obesity are all factors in terms of muscle pain. So what are some of the home remedies that we can do? The first one is abdominal exercises. And that doesn't necessarily mean that a person with back pain needs to be doing 500 crunches every day. But they might want to do postural work. They may want to do pelvic tilts. They may want to do basic stretches. They may want to do a few crunches on a regular basis, as long as it's not causing more back pain. The second thing is here, stretches at least once a day. And in future shows, we're going to actually go through some of the best stretches that you can do for improving back pain. But right now, we just want to list it to say that stretching every day is going to go a long way to reducing the back pain. I mentioned pelvic tilt. Posture is one of the big issues in terms of back pain. So just doing postural intervention every day, just tucking the pelvis, making sure that the core is nice and tight, also goes a long way to reduce these symptoms. I have here an ergonomic chair. Most people, they sit in a regular chair and might not be that comfortable, or they're sitting in a chair that's their comfy chair that's way too comfortable, but it might not be great for the back. If you're interested in having better posture at work, you might want to talk with your boss about having an ergonomic chair. You can look online, you can get them anywhere. Getting the right amount of sleep. This is the first condition that we're talking about that actually has a pretty strong relationship to getting the right amount of sleep. We'll talk about how much you need in a couple more slides here, but we want to make sure that when you sleep a lot, you get the right amount of sleep, you can actually heal your back pain better than if you're only sleeping a couple hours a night. So people who have insomnia usually have worse problems with their back than people who get regular sleep. Proper lifting technique, which we'll talk about in a future episode, and also the use of complementary medicine. I myself have been going to chiropractors since I was in high school. I think that in terms of back pain and back restructuring, they do a fantastic job. When I had my severe back injury a few years ago, I went to our local physical therapist, Dr. Mori Hayashida, who was a guest on one of our previous episodes, and his staff did a fantastic job in getting my back pain-free in just a few sessions. So I recommend, in terms of taking just muscle relaxants, I say that you should probably look at chiropractics and physical therapy as the mainstay for back care, as opposed to using only some sort of opioid for the back pain relief. And the last thing I have here is to keep strong. People who have strong back muscles, who do squats, deadlifts, regular exercise, leg work, etc., they have less problems with back pain. And I've been very lucky. I've only had one episode in my adult life, and I've been engaged in sports for many, many years. So I feel very lucky, and I think that one of the reasons that I have few problems is because I keep my back muscles strong. All right, I talked about back pain and sleep. How much sleep should you get? Well, most people need about 7 to 9 hours of sleep per night. A lack of sleep increases health disorders like autoimmune, depression, allergies, back pain. Pretty much anything can be enhanced by having not a lot of sleep. It costs businesses over $18 billion a year, and that's just in direct cost. We also have indirect cost of what we call presenteeism, where people are at work, but they're just staring at their computers because they're too tired to do a lot of their work. They're drinking 3 or 4 cups of coffee in the afternoon just to keep themselves going. But sleep problems, they can be, you may want to go to a sleep clinic, but you also might want to say, well, do I get up every night at 1 or 2 in the morning, and then what do I do? You have to look at what the cause is of why you're having these sleep issues in the first place. And so if you can identify some of those, like, you're worried, you're stressed, et cetera, you might want to enhance those by doing some specialty exercises, and we're going to talk about that in a couple slides. Some remedies. Well, one of those remedies is breathing exercises. Most people do not take deep breaths during the day. They don't relax. They don't take any time to relax. I remember when I was in college reading a study about folks who did a meditation for 20 minutes a day. They only needed 5 hours or 6 hours worth of sleep. So getting meditation, maybe getting extra sleep on weekends, and looking at and enjoying relaxation tapes are very good ways of being able to enhance your sleep patterns. Another one is hypnosis. And I do know that people who have sleep problems who do go to a hypnotist say that it works fantastic, that within a 30-minute or 1-hour session, they can actually enjoy more of this deep relaxation. And really, sleep, the main function of sleep is to help to rejuvenate the body. And if you can do that through meditation, you might be able to subside on less hours of sleep per night, but still feel rejuvenated the next day. And the last thing that I have on here is the hormone melatonin, which you can get in a tablet form, as opposed to prescription drugs. There are many sleep drugs that are on the market. I see them advertised on TV every morning on the morning shows. But melatonin has been shown for decades to really enhance a person's ability to sleep well, to relax well, and to sort of lower the amount of stress that they have. And speaking of stress, this is our last condition that I'm going to talk about here on this episode. It's one of the major causes of illness in the United States. 50% of folks have adverse health effects due to stress. 90% of our illnesses may be stress related, and hundreds of billions of dollars are spent on compensation of stress, whether it's medical, counseling, whether it's prescription drugs, all kinds of things. Stress is probably one of the biggest issues. I know that I spoke in one of our previous episodes about cancer diagnosis, and a lot of people feel that stress is one of the contributing factors to cancer. So what do we look through in terms of working through stress during the day? Deep breathing exercises, same as what I said for back care. At the university, I use a machine called a Respirate, which is basically a biofeedback unit, and it works terrific to reduce blood pressure, enhance breathing, etc. Listening to relaxation music at home, measuring stress symptoms like measuring your heart rate, measuring your blood pressure on a daily basis, and maybe an aggravation scale, like I feel ticked off on a scale of 1 to 10 today. I'm at a 7. I want to get down to a 2. And knowing what your triggers are. If you don't like driving in traffic and traffic upsets you, you need to say, I'm going to leave 20 minutes earlier, or I'm going to take a different route, or I'm going to talk with my boss about coming into work at a different time so I can avoid these traffic issues. We need to look at the triggers that make us crazy in terms of stress and figure out how we can lower those things. And the last thing here, which I said is not really a condition at all, it's dehydration. And most Americans don't drink enough water. Most people probably should drink at least 10 to 12 ounce glasses of water a day. As a matter of fact, some people are actually saying you should be drinking about a half a gallon of water a day, depending on what medical condition that you may have. Does that mean that if a half a gallon is good, then 2 gallons is better? No, because hypernatremia is a condition where you drink too much water, and we've actually had people in running races who've actually died from drinking too much water. So let's stick with the 8 glasses of water a day, 12 to 16 ounces, and drinking them through the course of the day. It helps pretty much with everything. It helps with digestion, it helps with your circulation, it actually helps you relax, it helps with body fat storage, it helps with your heating and cooling system, and actually helps you to sleep better. So drinking enough water is really one of the best things that we can do in terms of sort of what we call keeping our homeostasis of the body. And I'm going to close the session today by telling you that all of these types of things can really be monitored by you on a daily basis, but you should visit your doctor on a regular basis, have a list of questions, talk about any medications that you might be taking, talk about PT or any other therapy that you're interested in. And if you're having surgery, what sort of healing time should you have, out-of-pocket expenses, second opinions, et cetera, et cetera. All of these things are going to help in terms of your general overall stress, and they're going to help you feel better. So every day when you get up and you say, what are the best things that I can do for my health? You know, is it water? Is it food? Is it shopping? Is it my therapy? Is it my supplements? Is it my overall outlook on life? Is it my relaxation? So if you can put all those things together, you're going to have a much better sort of self-care routine during the course of the day. So thanks for listening. I'm Eric Durack for Med Health Fit, and we hope to see you on the next episode.